I got a highly requested video coming up, gastroparesis, what really causes this? Why do you have it? There's so much misunderstanding. We're going to talk about the root causes. And if I have time in the end, I'm also going to share what I did with Susan, my one-on-one client who recently overcame gastroparesis, what we did there in her healing protocol, giving you a few of those insights. Now, without any further ado, let's get started. Gastroparesis is not fun, but please know that first of all, you're not alone, and second, yes, you can heal. Even if your doctors tell you it's incurable, there is hope on the horizon. And that's why I would love to introduce you to Susan, my recent one-on-one client, 45 now, and lives in Massachusetts. Susan was diagnosed 3 years ago with gastroparesis when she was not able to eat more than a few tablespoons before she felt full. She was also having nausea, occasionally vomiting, maybe once a week, depending on if she was on medication or not. And she lost a lot of weight because of the malnutrition. She wasn't able to eat enough. They diagnosed gastroparesis through different tests. She did endoscopy, GE scan, the gastric emptying scan, where they have you eating radioactive eggs. And she also did the C13 breath test, drink citric acid, which is the worst thing for the stomach. After all those tests, they put her on metoclopramide, which is supposed to help with the stomach motility. However, it has a black box warning. Black box warning in the US from the FDA is the highest ranking and the highest warning sign basically for doctors and patients that this drug that they're taking has serious health risks. In her case, she took it 2.5 months. It was 40 milligrams per day, and she got only mild side effects with dizziness, tiredness. She had restlessness in her body, so she wasn't sleeping well. It helped a little bit, but then her symptoms got worse than before, and this is when she came in, I think it was October 2022, basically telling me that doctors are the worst and that she doesn't know what else to do. One of the first questions I ask her, which I usually do with one-on-one clients, is what happened before your symptoms started? So her symptoms started 3.5 years ago. Her husband divorced her, which was very traumatic for her, and then 4 months later her family dog died, where she had a very strong bond. And I'm sharing this because that I see this happening a lot, not just with gastroparesis, with all kinds of chronic conditions, that there is a tipping point. And trauma and stress, like in Susan's case, they were a trigger. They are not the cause of gastroparesis. They tipped her over the edge. Immune response lower, so you have a more fragile condition. And then every chronic condition that is lingering there suddenly comes to the surface. In Susan's case, because of her long-standing trust in academic science, because she was in that field as well, she trusted doctors and the testing and the medication, tried to figure out what's wrong with me, but wasn't really connected to her gut feelings. To her trust in her body was completely broken. I'm not functioning and I don't know what else to do. In some cases, doctors can find out a cause for gastroparesis, like diabetes or surgery. Medication damage is a big one as well, but 50%, as so was Susan's case as well, are idiopathic. Fancy word for doctors don't know. I would like to bring in our demonstration stomach here. Let's call him Pete. Most of the causes for idiopathic gastroparesis are actually neurological. So you see the blue part here of Pete, this is the muscle. Your stomach is actually a big muscle with a hole in the middle. Those muscles are supposed to contract. The contraction of those muscles is orchestrated by the nerves that are everywhere here around the muscles, right? They fire and then the muscles contract. And the same for the sphincter, which is here, the end part, and also the sphincter up to the esophagus. So here's the esophagus, and this is the sphincter to the small intestine, which then opens, lets the pre-digested food through for the small intestines, and this is closed, so there is no heartburn or food particle traveling up the esophagus. Now, when there is an inflammation in the nervous system, especially the vagus nerve, so this is one connection, the nervous system is inflamed, then the muscle contraction can't happen, and basically Pete here is all confused, doesn't know what to do, and goes into a stomach paralysis. The question, however, is why is the nervous system inflamed? Often it's viral. Epstein-Barr medical medium talks about gastroparesis being caused by viruses like Epstein-Barr and what they excrete, which is highly toxic for the nervous system and can pass the blood-brain barrier. Toxic heavy metals are another one. Medication can lead to extreme inflammation in the nervous system, but also in the stomach itself. And pathogenic bacteria like Streptococcus. But the biggest one really is viral in combination with toxic heavy metals, which often feed viruses like Epstein-Barr. I also have a video about that if you want to check that out. If we know what causes gastroparesis, which most likely, if it's not diabetic and if you didn't have stomach surgery, it's very likely that is nerve related and its neurological system is impaired, then we also know how to address it and we can heal it. I just want to give you a few glimpses because it needs to be individualized what we did with Susan, what helped her to overcome gastroparesis. So she can eat normal 3 meals now. It took us about a year to get her to a state where she can now eat normal meals, has her energy back, nausea and vomiting is gone, but she's still watching what she eats and she really takes care of herself, especially in the stress department. So the first thing to help Pete, which might be so simple, but it's really, really important. I can't stress that enough. Don't eat when you're stressed. And when you eat, chew really, really well. Digestion starts in the mouth, especially the carbohydrates are getting digested here. And the smaller you make the pieces, the less Pete has to work. That's just a side tip, but it's extremely powerful. One of the best things you can do for your gastroparesis, for your stomach, is this green thing here. I actually just cut it fresh for you, so it might be still dripping. This is aloe vera. In the case of Pete, you're going to need a lot of that. So ideally you have an aloe vera dealer, fresh plants in the garden if you live somewhere there, or you can also buy the gel. It's important that it has no citric acid, no preservatives, and it's really just aloe vera gel. Okay, this is dripping now. And then aloe vera, you want to do a lot of that. Do at least 6 tablespoons per day. That's 3 in the morning and 3 in the evening. You can cut the inner gel, don't use the green part. You can cut the inner gel, put it in the blender with some water, or you can just eat the gel. Really slimy, but it works. Aloe vera is amazing for Pete because it soothes the stomach lining. It's also antiviral, antibacterial, so we address the root causes, and it soothes the nervous system as well. If you have any injury in the stomach through medication like Susan had, or any toxic heavy metals lingering there, aloe vera can help to heal wounds and really heal that scar tissue that you might have in the stomach. And the 2 classics that we talk a lot about on this channel, we did also with Susan. We did celery juice, 16 ounces in the morning on an empty stomach and 8 ounces before bed. Again, more information here on the channel. And we did lemon water as well during the day, especially lemon water shots before 30 minutes or 15 minutes before she ate anything, to prepare the stomach, to really stimulate the gastric juices, the stomach acid, and also the muscles. So just a few things we did. Also, diet is extremely important. I still hear those stories from her case. It wasn't the case because she was vegan. I hear this: eat eggs, right? Eat eggs because you don't feel anything, they don't have any fiber, so this is good for gastroparesis. No, it's not. It's really not. It's very hard to digest. Has protein, has fat, it sits there in the stomach. And also eggs, like dairy and gluten, they feed viruses and bacteria like Epstein-Barr and just inflame the whole nervous system more. I also don't recommend to eat a lot of animal meat because of the proteins, very hard to digest, and can then also later digestive tract just sit there and rottening. And you have ammonia gas release, inflammation, and the whole nervous system goes crazy. Instead, especially if you have gastroparesis acute right now, I recommend to go for monomeals, at least 3 days. This is what we did with Susan, really holding hands step by step, walking her through the process. We did monomeals, we tried fruits, we tried ripe bananas, really just ripe bananas for 3 days. Or if the fruit doesn't sit well with you, you can also do potatoes. Just cooked potatoes with a little bit of sea salt. I know it's extremely boring, but for Pete, it's the best thing you can do. Then later we introduced more cooked foods, soups, fresh fruits, and again, no eggs, no dairy, and no gluten. This is just the first steps that you can do to really see some progress with your gastroparesis. We did a lot more with Susan, which was personalized to her case. If you'd like more help, I can offer you 2 things. The 1-week stomach healing challenge, which is a program that I created for anybody dealing with gastroparesis, but also gastritis, stomach irritation, stomach pain. And you can get started here with a 1 week with meal plan, shopping list, healing foods explained, really taking you hand by hand through the process. Or you can get my secret stomach pain reliever. If stomach pain is an issue for you, you can download that here for free with 3 simple ingredients that you can get almost anywhere that help you make your Pete, your stomach happy. Also recommend to watch this follow-up video over here.